Hi, this is Dr. Sinagra. I'm with Julian Liebman and his mom. And Julian, I'm going to ask your mom and you some questions. We want to find out the purpose of these videos, of course, is so someone's out there listening on the web, or if they find us on YouTube, that they can feel comfort in knowing that someone with their condition has gotten better. But Mom, I'm going to start with you. When you first got here, you told us that your son was suffering from Crohn's disease, an autoimmune disease of the bowel. He had a lot of belching, fatigue was massive, cramping, diarrhea, losing weight, inability to gain weight. Anything you want to add to that?
He was just not himself. It was awful. He was always in pain, and he was missing a lot of school because of it.
So you went the medical route,
We did.
which most of our patients do before they come to see us. And they diagnosed him with an autoimmune condition of Crohn's disease, correct?
Correct.
When was that?
I would say that was back in January or December. the end of
Okay, so
December.
at the beginning of 2016.
Right.
All right. What did the treatment consist of?
Pretty much they had him on antibiotics at first, which I think hurt his stomach even more because he still had the abdominal cramping. Then they put him on prednisone, and symptoms weren't getting better. He wasn't getting better, so I was desperate to try to relieve my son's pain. So I searched for an alternative route.
Okay. Julian, how old are you?
11.
Okay. How'd you feel? Not good, huh?
Yeah.
Tell everybody about it. What was you? Did you just feel weak?
Yeah, really. I couldn't do really much anything until after I got better.
Okay. So, Mom, you called here and we discussed what we do with our structural metabolic approach, meaning we look at diet, we look at inflammation, we looked at Julian as a whole functional being, not just a large intestine that's being affected by Crohn's disease. And that's the big difference about what we do. We check diet, gut function, immune function, thyroid, adrenal function, inflammatory markers. We also checked him structurally for the upper cervical chiropractic care. That's important too. Were you surprised it was a chiropractor that was running the wellness center?
A little,
Yeah.
a little.
A lot of people do that. They ask us, why is it a chiropractor? I said, well, because medical doctors prescribe drugs. And so when you get into a wellness approach, there's no one that's more versed or educated than doctors of chiropractic. And our whole job is the restoration of function so you heal. So this crazy chiropractor you went to see put you on this diet and told you to take some supplements and get your child adjusted. How'd he do?
He responded quickly within a couple of weeks. He had more energy. The abdominal cramping went away.
Let's see, what date was your first visit? Let's go back and take a quick.
Sure.
I got you down here for your first visit was. Let me double check. Was 3/21, correct?
Mm-hmm.
Yeah. So it's March of 2016. Now it's June,
Yeah.
just about. It's Memorial Day weekend coming up, 2016. How much improvement has your son had, percentage-wise?
100%. I have to say.
In 3 months.
All the symptoms that we've just discussed, gone.
And bowel movements are normal again?
Bowel movements are normal. He hasn't had any abdominal cramping. He has more energy than I've ever seen. He's functioning like a normal 11-year-old boy.
Isn't that great? How you feeling, pal?
You're great.
Yeah, good. It's nice to feel good, isn't it? Yeah.
Thanks, Uncle.
Yeah, you're doing great. You're doing really good. The main issue is understanding that a lifestyle change with an autoimmune patient can mean everything. And removing of food allergies, removing of inflammatory foods, restoring proper adrenal function, gut function, checking the immune system, all what we did, removing any subluxations from the upper cervical spine, which is vital because that affects the vagus nerve, which affects all function of the digestive system. Are you happy with the results?
Very.
Yeah.
Very.
Would you recommend it for anybody with Crohn's disease?
I would. I definitely
Okay.
would.
That's what this is for. Anything else you want to say, Julie?
Not really.
Okay. Feeling good is what you really care about, right?
Yeah.
Okay.